lip filler appointments are extremely popular, and we find that when patients request them, they're wanting something to look a little bit better than what they currently have. So if you have really thin, small lips, it might be better to go with a softer filler that will help to shape the lips, the border, the vermilion border of the lips, with giving a little bit of volumization to the body without making it look too large. We find that in patients who want a slightly bigger lip, or in men, if men would like to have lip augmentation, we go with a slightly thicker, slightly stiffer filler, such as that one and that one. And what that does is it gives slightly more projection in the lip and a little bit more shape. So when doing lip filler, it is most certainly a marathon, it's not a sprint. We review patients after a few months, and then we can put in a little bit more lip filler at that appointment. The greatest majority of lip filler that we use is hyaluronic acid based, and we do that because hyaluronic acid is a naturally occurring compound in the body anyway. It is one of the main building blocks of collagen. The hyaluronic acid that you find in these fillers are done using a pharmacological process of manufacture, so they don't come from any animal sources. What that means for you as the patient is that your risk of allergy is incredibly low. In about 6 years of doing facial aesthetics, I've not had a single patient that has become allergic to hyaluronic acid fillers. That being said, we only use premium brands of dermal fillers here at Elite Aesthetics, and there's a few reasons for this. The most important one is safety, and that is these are fillers that are made in multiples of syringes. So for example, the one brand to my left puts out 20 million syringes a year, and the other brand about 10 million, because it's a slightly smaller pharmaceutical manufacturer. We make sure that when you come for your lip filler appointment, that we make sure that your pain is managed. So is lip filler painful? Yes, it is. Lips are very vascular. They've got lots of free nerve endings around them, and we find that injecting them directly does cause a little bit of pain and discomfort for patients. And we manage this in one of two ways, either by using a topical or using a numbing cream or a numbing gel that we apply to the lips for a few minutes, sometimes possibly about 10, 15, maybe 20 minutes, depending on the level of numbing that we're looking for. And then we use the product we then inject the lip filler into the product, into the lips. We may also decide, based on what the patient's individual clinical needs are, we may even do the lip filler using a dermal cannula. Another kind of anesthesia that we can use is a directly injectable anesthesia, and that is pretty much like a trip to the dentist. So you get these injections inside the gum, 3 on the top, 3 on the bottom, and it renders the patient pain-free and anesthetized for probably in the region of about 2 hours. The fillers themselves do come with lidocaine, so they do come with numbing in that, and that is purely for patient comfort. We find that we've still got to get the filler into the lips, and so that's why we use either a topical numbing or we use injectable numbing on top of that. In terms of swelling, very commonly patients ask, how long will I swell for? And the greatest majority of patients, I would say probably in the region of about 80 to 90%, you would look at swelling that is actually observable and swelling that is obvious for about 24 to 48 hours. We use very, very simple measures to help with bringing the swelling down after lip filler injections, and that is really just using an ice pack or something quite nice and cold for a few minutes in the nights after having lip filler injection. No real medication is required, and certainly no anti-inflammatories are routinely given after lip filler injection. The full result after the swelling can be seen in about days 7 to 10, at which point most patients will be like, I quite liked it when I had the swelling. So as I've said previously, it is a marathon, not a sprint. We prefer the patients to get used to the new shape and the new volume in their lips. We also take into account patients who may have loved ones who may have an opinion about lip fillers, and it's easy to actually overstep that mark and to put too much lip filler in. Yes, we can dissolve lip filler, but we choose not to in the first instance, just because it's not a dissolving agent or Hyalase or hyaluronidase is not just a simple erasing method. It carries risk with it because it does come from an animal source, and with dissolving filler your risk of allergy is significantly higher. So just do it right the first time. We put in the lip filler and we wait a period of time that we decide together in our treatment plan with myself and you as to when we would look at perhaps augmenting the lips to make them go a little bit bigger, or in some instances when we would be maintaining those lips. So it is really important to understand that lip filler is, if done responsibly, leads to a beautiful and natural result, and not necessarily a result that is not enhancing the patient's look or enhancing the patient's lips, but actually distorting it. And we're quite passionate about that here at Elite Aesthetics, to make sure that we don't create those monster lips that you sometimes see on social media.